Hello, hi everyone. Today let's discuss about the types of cancer and their symptoms and their diagnosis and treatment. So, the first cancer is carcinoma. Carcinoma is nothing but the normal cells are damaged beyond repair, means they cannot be repaired at all. And the main cause for this is radiation or UV light exposure towards UV light, tobacco, chewing, and then benzene and some poisonous substances. And the symptoms of this mainly includes the symptoms based on location, like if the cancer occurs in lungs, then the symptoms are cough and chest pain. If the cancer occurs in colon, then the symptoms are diarrhea and blood in stool, that is in motions, and the common symptoms are like fever, chills, and weight loss. And the diagnosis of this carcinoma is mainly done through CT scan, that is computerized tomography scan, or by complete blood count, or by biopsy of tumor. Biopsy is nothing but cutting a particular section of the tumor and then examining it. And also bone marrow biopsy and chest x-ray and a CT scan for exact location of the tumor. And then treatment. The treatment mainly involves the radiation therapy or chemotherapy or maybe both. This chemotherapy we will discuss in the next video. And the next cancer is sarcoma. Sarcoma is nothing but it is a bone tumor which occurs because of abnormal growth of non-cancerous cells. And the main cause is inherited and radiation. Inherited in the sense it may be inherited from forefathers, and because of radiation it may occur, and the symptoms includes the bone weakness and pain of the bone, and the bone breaks without any reason. Without the reason the bone may break, and immovable bone, the bone cannot move properly, and weight loss. And the next one, diagnosis involves mainly x-rays, biopsy will be done, and magnetic resonance imaging will be done, and radionuclide bone scans can confirm this sarcoma. And treatment mainly involves amputation, chemotherapy, surgery, and radiation. And the next one is hematological malignancy. This malignancy mainly affects blood, bone marrow, and lymph nodes. And the cause is the same, inherited, radiation, or any other tobacco chewing, it may be of any cause. And the symptoms are mainly based on location, like the lungs may cause cough, chest pain, like that. And then the diagnosis involves complete blood count should be taken, and biopsy is done for knowing or for detecting this cancer. And the treatment mainly involves immunotherapy or chemotherapy. And the next one is leukemia. Leukemia mainly affects bone marrow and the lymph system. And mainly the cause is T cell leukemia virus. Because of T cell leukemia virus, this leukemia will occur towards the patients, and the radiation is also another cause. And symptoms involves mainly weakness of the patient, fever, weight loss, and bone pain, bleeding from the gums and nose, and blood may fall from urine and stools. And also the next one, diagnosis involves mainly physical diagnosis like swollen gums and lymph nodes. If the patient is having swollen gums or lymph nodes, swollen gums or lymph nodes means nothing but inflamed, means swelled lymph nodes or increased in size lymph nodes or gums is the physical detection. And also enlarged liver, and complete blood count and urine test is done, and also biopsy is also done for detecting this cancer. And then next one, for in the treatment, this is mainly done by two types of treatment, that is induction therapy for killing the cells or decreasing the cells, and initiation therapy for killing the remaining cells. And also chemotherapy is also recommended. And the next one is chronic leukemia. This chronic leukemia is mainly, it causes too many white blood cells are produced in bone marrow. These too many white blood cells in bone marrow is called as this chronic leukemia, and it may mainly occur because of genetic reasons or environmental factors. The symptoms are same: swollen lymph nodes, enlarged spleen, fatigue, fever, and night sweats. And the diagnosis is same like others, and the treatment is same, the chemotherapy, but here bone marrow transplantation is also done. So this is about the types of cancers. Thank you. Jai Hind. Subscribe to my channel for more and more informative videos.